someone comes to a physician for a arthritis type of problem, an overuse injury or a stress injury, then the treatment and the standard treatment becomes very similar. And I'm sure you've all heard this before. So rest, ice, compression, elevation, right? So it's the RICE acronym. And with that, resting is important because that decreases the repetitive function that continues to injure that joint. The ice is to reduce inflammation and swelling, and also to reduce pain. Compression with, say, for example, an ACE bandage or some other type of wrap will reduce swelling in that area, which is also beneficial. And then the elevation portion, which allows for blood flow and return of that extra swelling, that extra inflammatory fluids to come back to the heart. So this is the core of what the initial management for an injury like this could be. Adding on to that are non-steroidal anti-inflammatory medications. So NSAIDs is what we call those. And NSAIDs are things like ibuprofen, naproxen, naproxen, and other things like celecoxib or Mobic. Okay, these are all brand names, or some of those are brand names, but they essentially are the same. They are anti-inflammatory medications that reduce inflammation and then also have pain reduction and fever reduction qualities as well. And they work through the process of reducing the cascade of inflammation. Okay, they are COX, which is an enzyme, COX enzyme, and that is important in the cascade of arachidonic acid metabolism, and that cascade is essentially your body's inflammatory cascade that ends up bringing up cytokines, ends up causing pain and inflammation and swelling. So physiologically, that's how medications like ibuprofen work on the body. Okay, so rice plus ibuprofen, and then finally physical therapy. Right? So physical therapy is incredibly important, which would be to start slow and let your body be your guide. You don't want to reproduce an injury. You don't want to exacerbate the injury. But what you want to do is work on those muscles by stretching the muscles, stretching the joints, increasing range of motion initially, and then getting to strengthening the muscles around it in order to improve outcomes and functionality. And so that tends to be the mainstay of therapy.